my name is Mary Bafa and I'm a level 2 Mohammed Master Nursing student. Today I'm going to be demonstrating how to do a subcut and IM injections. So first of all, I'm just going to ask the patient's name. Hi, what's your name? And I'm just going to use 2 patient identifiers just to make sure it's the right patient. So I'll just use the wristband and date of birth and the name of the patient. So since Mr. Mancini looks like he has a normal build and normal muscle tone, I'll just use the normal gauge sizes and for both the subcut and the IM injections. So double check the information with the Mars and ask the patient for any allergies just to make sure. So first I'm going to demonstrate how to do a subcutaneous injection, and before doing anything I'm just going to do hand hygiene. And I'm going to put my gloves on. The normal gauge size for a subcut injection is 25 to 27, so that's what I'm going to be using today. First of all, I'm just going to open the vial, and using alcohol, I'm just going to clean it. And then I'm just going to take my syringe. And first of all, I'm going to put the blunt needle on just to draw the medication. And since I'm delivering 1 ml of heparin, which is an anticoagulant, I'm going to push in 1 ml of air into the vial. I'm going to inject into the center and push in 1 ml of air. Okay, now I'm going to draw 1 ml heparin into the syringe. And just make sure that there are no bubbles in the syringe. So just get rid of any if there is. Okay, so once we have the 1 ml, I'm going to place the cap on the needle using one-hand technique for safety. And I'm going to label the syringe with the medication name, dose, and route, and just put it to the side. And the common sites for subcut injections are the abdomen, the back of the arm, and the thigh. So today I'm just going to be injecting into the abdomen since that's the most common site. And I'm going to inspect and palpate the region below the umbilical cord for any lesions, mass, swelling, redness, anything. Okay, so there are no mass or abdomen lesions, anything. Next, I'm just going to take an alcohol swab and just clean the area, the sites of injection, using circular motion. And just place it in the garbage. So I'm going to use the 25 to 27 gauge, and before doing that, I'm going to remove the blunt needle and dispose it into the sharps container. And now I'm going to place the actual needle on and remove the cap. So to do subcut injection, I'm going to pinch the skin and just using a 90-degree angle, just going to inject into the patient. Okay, and once it's done, I'm going to dispose of the needle into the sharp container and just use a gauze if necessary for any bleeding or anything, and just after the injection is done, just ask the patient how they're feeling and do a patient education on how the medication works. Second injection is the IM injection, and before doing anything I'm going to do hand hygiene. And again, to double check the medication, I'm going to ask the patient for 2 identifiers and double check with the Mars just to make sure that the 8 rights of medications are met, such as the right dose, right patient, right site, and right frequency. So once that's done, I'm going to put my gloves on and I'm going to assemble the needle. So for an IM injection, the gauge size is 20 to 25, and since we're doing 0.5 haldol, I'm going to be using a 1 ml syringe. So before doing anything, I'm going to use alcohol and just clean the vial. And then I'm going to take my syringe and the blunt needle. I'm going to put the blunt needle on and just remove it. And since we're doing 0.5, I'm just going to be injecting 0.5 into the vial. Air. Okay, and then draw 0.5 ml of haldol, which is an antipsychotic drug. Again, just make sure there are no bubbles in the syringe, and if there are any, you can just tap it to get rid of any. Okay, so once we have that, again, I'm going to place the cap using one hand technique for safety. And I label the syringe with the medication name, the route, and the site, and just put it to the side. So the common sites for an IM injection are the deltoid muscle, the vastus lateralis muscle, and the ventrogluteal muscle of the thigh. Since the patient has a normal build in muscle tone, I'm going to be injecting into the deltoid muscle, which you can find by placing 2 fingers below the bone of the shoulder and just inject below the 2 fingers into the deltoid muscle. So before injecting, we're going to inspect and palpate the site of injection for any lesions, mass, swelling, redness, temperature. So once that's done, I'm going to use alcohol swab just to clean the site of injection using a circular motion. And I'm going to dispose of the blunt needle into the sharp spin. And place the actual needle onto the syringe, which is again 20 to 25 for an IM. Okay, remove the lid. For an IM injection, we're not going to pinch the area, we're just going to use 2 fingers to spread. And using a 90 degrees, we're going to inject into the patient slowly. Okay, so once it's done, we're going to dispose the needle into a sharp spin and ask the patient for any signs of dizziness, anything like that, and if they're feeling okay, and just do patient education on how the medication works. And before leaving, just make sure to document both the injections onto the MARS just for the records. Okay, perform hand hygiene. And if the patient feels any dizziness, anything like that, you can either call bell to ask for help.